Hi, this is Robert Plenick, owner of Brutal Iron Gym. I wanted to show in this video a movement therapy routine that we created for a client recently. So the person was having lower back nerve pain related to various movements. They couldn't really pinpoint an exact movement. They just said whenever they would get up out of a chair, sometimes it would tighten down, sometimes when they were walking for long periods of time, or changing direction, or on uneven surfaces, they were having a lot of back pain. Through our discussion, we found out that the issues were related to tight muscles in the front side of the hip and the back side of the hip. Some of the tightnesses were related to muscles being strong and trying to do a lot of work, almost too much work. And some of the muscles were tight because they were weak. They couldn't keep up with the work demands of everyday life, and therefore they clamped down to try to prevent movement, and that was causing a lot of issues. So the movement therapy routine that we created is what I'm going to show you in this video. It is specific to the client. However, it might be beneficial for other people to try. You may find that certain aspects of this are beneficial to you. Nothing would be harmful. So you might try it and not feel anything, but none of this would be dangerous to try. So the first thing in the routine is we're using a elastic band that has like kind of a cottony material so it's comfortable in the skin. This is made by howmuchabench.net. or Slingshot. It's a company owned by Mark Bell. And this is called a hip circle. There are different sizes, different strengths. So the one that we gave to the client was specific to his needs. But there would be different ones available depending on what your strength levels are at the time of trying this routine. So we first start on some type of chair. So I'm going to sit on this. And you can use a desk chair, office chair, kitchen chair, anything you can sit down on. And we take the band and we're going to place it around both legs. And it's going to go just underneath your knee, like this. And that's going to apply some resistance to us if we try to push our knees out. So I want to keep my feet flat on the floor, make sure they don't lift as I'm trying to rotate my knees. So scoot back so you can see that a little bit. So if I start with my feet closer, it's going to make it easier for me. And then I'm also going to keep my back flat and lean forward. So a side view you'll see is a flat back, and I'm going to lean forward into the movement. This helps me isolate my small glute muscles. So in that position, back flat, leaning forward, feet narrow, I would push out into the band, again keeping my feet flat, and I would hold that for a second or two, come back in. Push out into the band, come back in. I want to make sure there's still tension when I come back in, but it's definitely lighter than when I push back out. So I'll try for 10 to 20 reps. If that gets too easy, you can actually widen your feet, and that'll actually make it harder. So you'd still come inward, but still keeping tension. But now I would push back out into the band, and now that my knees and feet are wider, it's going to give me more resistance. So we would do 3 sets of 10 to 20 reps. And if you can't do 10, bring your feet in narrower, make it easier. If you can do 20, keep trying to make your feet wider. Okay, 3 sets of 10 to 20 reps. Then we're going to come out of the band, and we're going to stretch the front side of our hip. We're going to get into a lunge stretch. So I'm in a lunging position. I have my knee on something comfortable. You can wrap up a sweatshirt, t-shirt, towel, anything you need. You want to put that under your knee. You're going to keep your stomach braced in terms of making sure it's flexed as if somebody was going to punch you, or if you're trying to hold your core nice and tight. You can even practice pulling your belly button in towards your backbone, and that'll help to activate your abs as well. From here, what we want to do is squeeze my glute on the knee that's down, the leg of the knee that's down. I want to squeeze my glute, and then I'm going to lean forward with my hips. I want to make sure I don't just lean my chest forward, and I make sure that when my hip comes forward, I don't just relax my abs and arch my lower back. So I want to make sure my abs stay tight, squeeze the glute, and I'm going to lean forward. Okay, push the hips forward. That's going to stretch the musculature on the front side of the hip. So I can flex the glute and push into this. Then I can actually relax my glute, and you'll notice that you actually push a little forward more. Then you can flex your glute again, but stay in that forward position. You'll hold that for 5 seconds. Then you relax your glute, and sometimes it allows you to release even more. So you want to do 5 contractions of 5 seconds per side. You only have to do that 1 time through. So the band is 3 sets of 10 to 20. This lunge stretch is 5 reps of a 5-second hold with that glute per side. Then from there, we're actually going to do some bodyweight squats to activate the muscles and even out the tightnesses of the joints. Okay, the muscles related to the joints. So our positioning is we would want our feet to be as wide as our shoulders or slightly wider. So one of the ways you can do this is to have your feet under your hips. You can rotate your heels out, then rotate your toes out. And that gets you pretty much in line with your shoulders. And then when we squat, we would actually push our hips back, and I'll show you a side view in a second. But we would push our hips back and push our knees out towards our pinky toes and stand back up. So knees out towards the pinky toes, stand back up. And you can bring your arms out in front like I am for balance. So if we want to look at the side view, I would find that same foot position. So feet under my hips, heels out, toes out. And then again, I would push my butt back as my knees go towards my toes, and then squeeze back in. So sit down. And if you can't go that low, that's okay. Just go as low as you can. If you feel any tightness in the knee, you can just do a shorter range of motion. So maybe the first set of three sets, I may only go this low. Okay? Then the second set, I can try to go lower. The third set, try to go lower. We would do 3 sets of 10 to 20 reps. So that'll be the routine that the client is going to do in the morning and at night. This routine takes less than 5 minutes, might only take 3 minutes in total, but it's something you can do quick and easy every day. The only equipment required is one of these elastic bands, which can be sold, found online, various sources like Amazon and stuff like that. So if you're interested in the information of this routine, send us an email to brutalironGym@gmail.com, and we'll send you the details of the routine. We'll send you the link for the band. So if you're having any kind of movement issues and pains that are kind of just robbing you of happiness every day, get in touch with us and we'll help you kind of create like a movement therapy routine, something like this that's effective, but it's quick, easy, simple. You can do it every day and regain control of your health and happiness. Okay? So email us if you need the routine from this or if you have any other questions. Or email us brutalironGym@gmail.com. Thank you.